This year I'm most proud of leading on the glucokinase hyperglycemia and bereavement projects. Both of them are really about linking genomics into maternity services to ensure that there's a confidence around genomic pathways in maternity care, but ultimately it's about improving patient care and outcomes.
I'm here in our Cambridge lab to celebrate some of our highlights from this year. Over the year, we've reported over 100,000 tests for rare diseases and cancer, and this is thanks to our increases in throughput and automation. And we've started rolling out diagnostic discovery reporting, which means that people who previously had rare disease testing in the past may receive additional results as a result of research and new findings.
This year, I'm most proud of working in the genomics service and witnessing the rollout of RNA Later, which is a solution that preserves fresh tissue for longer, enabling clinicians to send their tissue without reliance on the cold chain system.
This year I've been most proud of members of our Patient and Public Voice panel for their contributions to the development of the Cambridge Rare Disease Network Patient Passport.
This year I'm most proud of the fact that we've launched and published a Lynch syndrome app to support patients at risk of inherited cancer.
This year, I've been really proud to be able to get out and about across our region and engage with nurses across different areas, whether it's primary care, secondary care, learning disability nurses, and actually discuss genomics and the impact it has on nursing. The engagement has been really beneficial, and the opportunity to showcase some of that work that's going on in our region has been really, really helpful.
I'm very proud of all our Patient and Public Voice members, in particular into primary care, cancer genomic improvement programs, and access to whole genome sequencing for 17 to 25-year-olds, which we continue to push.
At the end of this year, we now have 8 hospitals delivering the Generation Study who collectively have recruited over 7,000 babies. A few of those babies have received a diagnosis for a condition that was otherwise unknown, and they've subsequently been seen by specialists and received early care that will hopefully lead to better outcomes for them.
One of the things I'd like to celebrate from 2025 are the fantastic trainees that achieved educational qualifications and professional registration, and the amazing colleagues that support them through this challenging process. I'm also very proud of our contribution to the innovative training resources from the Genomics Training Academy, whose implementation has helped us meet increasing training demands whilst maintaining our high quality standards.
So next year, I'm really looking forward to collaborating more with our lead nurses and midwives in the other regions on some really meaningful projects, especially across the East region, and also ensure that our work reflects the priorities within those trusts and delivers a real life impact to staff and patients.
In the year ahead, we're looking forward to our exciting new model where we'll be working more closely with our GMSA colleagues and hopefully with people from across the country. And also, we've just got an Illumina NovaSeq X, which will increase our capacity to do high throughput testing.
I'm also looking forward to next year to more clinician engagement for early referrals for children all under 25 to whole genome sequencing.
And next year, I'm really looking forward to expanding on our 16 genomics communities of practice to further our education, engagement and outreach with clinicians across our region.
Next year, I'm really looking forward to opening our National Holistic Care Hub for families affected with Fragile X syndrome, which is the most inherited cause of learning disabilities, ADHD and autism.
I'm looking forward next year to expanding that work and actually going out into individual trusts so we can sort of bring genomics out to everybody in nursing and just continue to raise the importance of it and how it's going to impact on our future careers.
I and colleagues will continue to campaign for a national screening programme for prostate cancer, which is essential to end the needless deaths of over 12,000 men each year in this country.
In 2026, I'm really looking forward to working with more sites in the region and making sure that everyone in all communities has the chance to take part in the Generation Study.
I'm also looking forward to the release of national strategies and guidance, which will inform how we best support the development of our workforce going forward.